Hi everyone, I'm Stephanie with 9Health. This is a 9Health virtual town hall. Our focus today is how you can help or receive help if you're needing help right now during this coronavirus pandemic. I'm joined by several experts that you can see on your screen from several different organizations across the state. I have with me Michelle Barnes, Executive Director of the Colorado Department of Human Services, Erin Poling, who's the President and CEO of Food Bank of the Rockies, Brooke Way with Vitalent. I always want to say it the wrong way, so Vitalent. And that's blood donations. She's going to let us know how that's all working right now. Dr. Robert Morris from Well Advised. They offer free tools to navigate Medicare, and Dr. Morris can answer questions on helping the elderly during this time, so we're going to ask him about that. And then, of course, Dr. Pyle Coley, our 9Health expert, is also joining us. She can answer any general questions about the coronavirus that you may have if you need to ask those right now. Ask any questions you have about giving help, receiving help. We're here to answer those questions for you and get those opportunities and that information to you. So first, Dr. Coley, can you give us an update? I kind of asked you this, I've asked you this last few days at least, an update of where we are at today with the coronavirus and just what we need to know today.
Yeah, so we have documented the biggest number of deaths in the last day. And as you may have heard, some of the models that the White House Task Force is looking at actually have predicted about 100,000 Americans may actually end up dying from this virus. So some very grim projections. And the 100,000 Americans dying is based on the assumption that all 50 states start doing stay-at-home orders. And we know that as of this morning, there were about 19 states that didn't issue stay-at-home orders yet. So this has certainly heightened our level of worry and fear. And I think we're at a period right now where it's critically important to continue to follow those social distancing guidelines, because it's the only intervention we have against this virus. This kind of an event is very important as well for us to figure out how we can get help and give help during this difficult time, because it is challenging for all of us to abide by these guidelines, but it's so important.
And I wanted to mention too, another way to get help right now is to call our new 9Health Neighbors line. It's 303-698-4455 extension 2005. You can call that line, or if you know someone that doesn't have access to the internet, doesn't have access to Facebook Live like this to ask questions, give them that number. They can call and leave a message with their question, and within 24 hours, a real medical professional, one of our 9Health medical volunteers, will give them a call back and answer their questions. So that's a great resource right now. I also wanted to mention at the start here that it's April 1st, it's Census Day. And normally during our 9Health fairs, the census is able to gather some of the information they need, but we're not having our spring 9Health fairs. So I want to make sure that everyone is reminded to fill out their census. The census determines funding for important health-related resources in our communities: healthcare centers, Medicaid, Medicare, children health insurance programs, and a lot more. Receive that federal funding based on the census in our neighborhoods. So go to 2020census.gov and fill that out. Again, this is our 9Health virtual town hall. Dr. Coley just gave us an update on the coronavirus and where we're at with that. You can ask your questions. But let's keep going with everyone. I'm kind of introducing everyone, asking them a question, and then we'll answer some of your questions on Facebook. Michelle Barnes, I wanted to chat with you. You're Executive Director of the Colorado Department of Human Services. I talked with you on Monday. You described CDHS as people helping people. So really, you guys are the place to turn for people that need help right now, or even those that want to help others, because there's volunteer opportunities. I wanted to give you the chance to talk about the big announcement that you had this week about childcare. Explain how that program is working, paying for childcare for essential workers.
Great, thanks, Stephanie. Yeah, so earlier this week, we were able to announce that the state, through some federal relief funds we're getting, is able to offer tuition credits on childcare for essential workers. And as you know, the list of essential workers is something the governor's put out through an executive order, and it's fairly broad. At this point, we're able to underwrite your childcare for up to 3 weeks, up to 6 weeks. It's even better than 3. And for that reason, we're asking people if they need a little assistance on paying for their childcare and they are an essential worker to go to covidchildcarecolorado.com and let us know, and we'll match you up to a provider or see if your existing provider is registered and be able to start underwriting your childcare.
Trying to go back to our gallery view. That's a great resource right now, especially for those essential workers that aren't getting to stay home. I mean, we get to stay home to physically distance ourselves, which good and a bad thing right now, obviously, but those essential workers are on the front lines and they really could use the help right now. So I think that's a great program. We did just get a question on Facebook about being laid off and getting food assistance. We have Erin Poling, the CEO and President of Food Bank of the Rockies. I'll kind of direct that question to you, but Michelle, I didn't know if you wanted to say something about that before I talked to Erin about food assistance, or if we should just direct it on to her.
Yeah, let me just mention, if people are interested in getting SNAP benefits, which used to be called food stamps, it's now called SNAP. Those are available for Coloradans. We're one of the states with the lowest participation in SNAP benefits. So we really encourage you to apply if you need food assistance, and that'll get you set up for over time. We're able to give you electronic benefits card that allows you to subsidize some of your grocery shopping. And you can sign up for that by dialing 211 and they'll set you up. But our partners like Food Bank of the Rockies are critical in getting food to people every day. So I'll pass to Erin.
And Erin, again, just want to introduce you, CEO, President, Food Bank of the Rockies. Talk about the food assistance that someone could get right now, since that was the question we received on Facebook.
Yeah, we've seen a tremendous increase in need right now. So we're at Food Bank of the Rockies, we're distributing double the amount of food that we were just 2 weeks ago, both directly through our drive-through mobile pantries and through our partner agencies. And if any viewers know someone or they themselves might need help with food, the best resource is Food Bank of the Rockies website, which is foodbankrockies.org, and go to the Get Help option to find a food pantry near your home. And it is all hands on deck right now. Like I said, we've doubled food distribution, and especially right now, it's April 1st. So we're getting phone calls from people saying, I can either buy groceries or pay my rent. And it's going to become very real as people start missing wages.
Yeah, I think that's a big issue right now, especially with today being, that first of the month since we've really been in the thick of all this. So that is a great resource. And I wanted to ask you as well how you're handling food donations right now, how that has all changed since the coronavirus.
Well, we receive a lot of donations from our retail partners like King Soopers, Safeway, Walmart, and those donations, because consumers have been buying out the stores, plummeted starting a few weeks ago. So that is starting to rebound slowly. So we've had to supplement that with a lot of our own food that we're purchasing, because we're committed through the duration of this pandemic to double the amount of food we're distributing. And we really had to alter our operations here at Food Bank of the Rockies to put in place social distancing. We're dependent on about 80 volunteers every single day. And then we have our distribution systems through which we're distributing food through our drive-through mobile pantries. So if someone wants to give back and is able to come volunteer and they're healthy, or would like to make a financial gift, we can make a tremendous impact in our community right now more than ever.
And if someone does want to help, just going to your website, foodbankrockies.org, to sign up to volunteer or contribute.
Yeah. Yep, foodbankrockies.org. And we've heard from a lot of supporters in our community saying, I can't come and volunteer because I'm a vulnerable population, but what I can do is I can donate, make a financial gift. And we've also seen a number of families who are healthy, who are able to come to Food Bank of the Rockies and volunteer. So however people are able to give back, just know that Food Bank of the Rockies is committed to our community. We're going to be here for the duration of this pandemic, and we are distributing so much food and nutritious food, a lot of produce to so many people in need in our community.
Yeah, that's wonderful, and a wonderful resource and a good way to help. If you are able to help there, that's a great place to go to help. Before we move on to, I want to talk to Dr. Morris next, but before I move on to you, I did want to bring up that someone commented about the childcare essential workers being only healthcare. It's actually several, industries that are considered essential right now. And you can go to covidchildcarecolorado.com. I'll post these websites we're talking about in the comments, so you guys have that as a resource. But you can find out if you qualify by going to that website, correct, Michelle?
That's correct. Thank you for sharing that. The definition of essential workers has broadened, and we're now able to accommodate anyone designated an essential worker.
All right, and Dr. Morris, I'll introduce you, Chief Medical Officer at Well Advised, and that Well Advised is one of our partners. They offer free tools to navigate and understand Medicare. You can go to well-advised.com and check out their website. You have a lot of resources on the website right now about coronavirus, COVID-19. Many of us have elderly family members, friends. What are some resources that you can share with us for the elderly during this time?
Well, of course, if you go to our website, you will find the resources there designed very specifically for two purposes. One is for people over the age of 65 who are on Medicare themselves. What are the facts about COVID-19? how do I prevent it? How do I stop myself catching it? And thirdly, what action can I take in order to avoid some of these things, and action to, if I have it, how do I get in touch with people and so on. But there is a third section, which is designed, a fourth section rather, designed very specifically for people who have elderly parents, who are relatives living perhaps, as we all do these days, at a distance from each other. How do we help those? So there's some very specific advice there for people in that position. One of the major things is that you are a big resource to other people. You are the person that is going to have most contact probably with your parent, and need to have most contact with your parent. You need to be able to talk with them, not to them, certainly not at them, and make a lot of persuasion about how they react to the situation, how they get comfort, how they essentially to get through all this, because they're going to need a lot of help. They're scared. We're all scared to a certain degree, particularly people of my age, for instance. And we know what it's going to be like. One of the problems is we don't know what it's going to be like, and we do not have enough control over the events that are happening around us. And so there is some advice there. And of course, you can go to 9health.org as well, and there are lots of information there about resources online. So that's, I think there's enough there for the moment.
Yeah, and I just wanted to ask you, and I just kind of, this popped into my head, but, and Dr. Coley can maybe talk about some of the new mask guidelines that have kind of come out, or some of the new conversation around masks. But I wanted to ask you if we're taking, if we just even need to visit a family member that's in the 65 plus group, but if we're all healthy, not showing any symptoms at least, do we need to protect ourselves? Should we all be wearing masks if we need to visit, drop groceries off, if we end up, I don't know, saying hi to them, if we have to go visit them or take care of them even, if, and they're not sick with COVID-19, but just taking care of them? Should we be wearing masks and taking those precautions?
Unfortunately, it depends where you take your advice from. WHO advice is that if you are not ill currently, you do not need to wear a mask, and it's probably better not to. There is some evidence that that may change as time goes on. Certainly, if there is illness or sickness and you have to visit in order to take care of somebody, you should be making yourself protected with whatever you can, certainly a mask at a minimum. So that would be the position that I would take, is that masks are probably at the moment not necessary if there's no sickness in the people that you are having contact with. For an old person, you shouldn't be having contact with anyone else, unless they're in your household already. As long as they're not ill, you do not need to wear a mask around your house. That would be my advice.
Okay, Dr. Coley, kind of same advice there.
Yeah, I would just add a couple of things. That one of the changes in the guidance has come from wearing masks universally, not as much to protect yourself, but actually to protect others from you, because we're realizing that a lot of the spreaders are the asymptomatic or minimally symptomatic people. So people who don't realize they have symptoms and therefore may be infecting others. So one of the reasons that the CDC is now considering the masks, whereas before they weren't, is again, not so much to protect the vulnerable population and such, because we know that masks don't work so well. They only filter the large droplets, not the small ones. But these homemade masks are pretty good at actually preventing your droplets from getting out. And that's where that guidance came from, where you can think about wearing a homemade mask, or, as the president said yesterday, using a scarf on your face.
And that's just really if we're gonna go out and need to go somewhere. We're not just, we're home with our families, we all need to be wearing masks now because we've been isolated together, so we don't need to wear masks if we're just sitting at home.
Yeah, absolutely right. Thank you for clarifying that. Yes.
Unless, of course, you're having some symptoms or something, something happens. Let's go now to Brooke Way. She's with Vitalant, and it's blood donations. It's an interesting topic right now because there is a need for blood. I mean, there's always a need for blood, but talk about the need right now that you guys have for blood.
And Brooke, before you get started, if you could just also answer the question, because a lot of people are asking, about how do you know that blood donations you're receiving are not infected with coronavirus. If you could address that question as well.
Mhm. Yeah, so the need for blood is ongoing. Patients need blood on a daily basis, no matter, what's going on with the coronavirus. So we really need to make sure that we keep that blood supply strong for those hospitals and patients that need it throughout all of this. So blood donations are still needed. It's safe to do so right now. We have seen a tremendous outpouring of support from the community, actually, since Governor Polis and Mayor Hancock said to go out and donate blood. It's an essential healthcare activity. You can still leave your house and donate blood right now. So we've seen a lot of people stepping up and supporting the community and donating blood. So right now we're actually asking people to make appointments for the days and weeks ahead so that we make sure we're on top of it and we still have the blood supply that we need in the coming weeks. So if you can't get an appointment right now, don't worry. Make one for a couple weeks ahead if you have to. We still need you. The patients that need to survive on blood donations still need you. So, and as to Dr. Coley, your question, there's been no known transmission in blood transfusion of COVID-19 with the research that we have now. So you shouldn't feel hesitant to receive a blood transfusion as well right now.
And someone just posted in the comments, are the Bonfils centers open? Bonfils is Vitalant now. So those, one and the same, but now they're called Vitalant. Talk about the centers and how people go to donate blood. So the safety around donating blood, should people be nervous about going somewhere outside of their home to donate? Just talk about the safety measures you guys are taking.
Yeah, so for the first part, we're now Vitalant, same company, just a new name. So for all those Bonfils fans, we are still Bonfils, just with a new name, Vitalant. And there are 8 donation centers across Colorado that you can donate at. We are operating on our normal schedule and hours right now. And we are making it as safe as possible for donors to come in and donate blood. You should not feel scared to leave your house and come donate. We are taking extra precautions to make sure that donors feel safe. Vitalant staff always follows a rigorous safety disinfection protocols. So they're wearing gloves, they are wiping down the donor chairs after every single one and disinfecting them. They are asked to either wash their hands or use sanitizer after every single donor. We are making sure it is as safe as possible for donors right now. We are following the 6 feet distancing guideline as well. So we don't want you to feel hesitant to come in because it is safe. And I know that some people might be a little scared to donate right now, but that shouldn't be something that stops you because we are making it extra safe for you right now.
Okay, perfect. And we had a question in the Facebook feed. I'm not sure if anyone can answer this or not, but I'm going to put it out there. Michelle Barnes, I'm not sure if maybe this is something you can answer. Someone asked if they're on disability, are they going to get the stimulus money from the government? Do you know if that's?
Yeah.
Okay.
The stimulus fund for individuals is available to every adult in the United States. It's going to be based on people who have filed a tax return. If you haven't filed a tax return in the last 2 years, they're putting together a very simple form that you can fill out that'll qualify you for the stimulus funds. So absolutely, if you're on disability, you are qualified for stimulus funds.
Okay, thank you for answering that. And I'll stick with you for a moment. I'm going to kind of talk to everyone about this, but talk about the other volunteer opportunities that there are. I posted a link to helpcoloradonow.org, which I think reroutes to covrn.com. That's right. The state's new website that has a lot of resources on it. That's where I found a lot of you lovely people to help us today, but has resources on it where you can, volunteer your time or receive help. So what are some of the biggest volunteer needs right now?
The biggest volunteer need for sure is in the medical field and for people doing frontline care. So if you have any skills at all, we'd really love you to sign up. We also are working with all our philanthropic partners throughout the state to make sure they have the volunteers they need. So Aaron mentioned that Food Bank of the Rockies uses about 80 volunteers a day. That would be an example of an organization we could hook you up with through Help Colorado Now. We're also putting an ask out to organizations that need volunteers to sign up on that. Colorado is amazingly generous, and we've had a lot of volunteers respond, so we are still looking for places to put them. So if your organization is in need of help, please sign up at helpcoloradonow.com.
And Erin, Michelle just mentioned the number of volunteers that you guys have per day. Do you have a need still for people to volunteer right now?
We do. We have an ongoing need for volunteers. It's how we're getting our operations accomplished every single day. And if Food Bank of the Rockies doesn't strike a chord for people, there are so many other direct human service organizations. Many organizations are in need right now. Project Angel Heart is another one that is still home delivering medically tailored meals.
Okay, perfect. And again, our 9Health Neighbors program is another volunteer opportunity. We are taking medical volunteers, non-medical volunteers as well. It's our new hotline. People can call 303-698-4455, extension 2005. I need to put that one in the comments for everyone as well. But it's a line you can call to chat with someone, ask questions. Again, you leave a message and someone calls you back within 24 hours. But we have volunteers that are ready and ready to take your calls and give those calls back. So give that line a call if you have any health questions or anything that you need. I'm going through some of the Facebook comments, just looking at things that people are discussing right now. I did want to mention this. This is on the 9Health Fair Facebook page right now. The Colorado State Emergency Operations Center is recruiting for immediate placements at some of their alternative care sites. They need medical volunteers. Those sites are in Denver, Fort Collins, Grand Junction, with a start date of April 8th, so in about 7 days. They need registered nurses, MDs, case managers, social workers, respiratory therapists. I mean, volunteers are needed right now in many places. If you're interested, you can contact Carrie Ann Rugg, and I have her email. I'll put that in the comments. If you are a medical volunteer and you're watching this and you're able to help, that's another place. But obviously, there's lots of help that is needed throughout right now. Dr. Morris, I want to go back to you. Again, you're giving us some advice for the elderly people in our lives. What are some ways that we can really help those elderly family members and loved ones when we can't even go see them or maybe visit them?
Well, I think the main thing, Stephanie, is to talk with them. That is by far the greatest thing, and to listen to them, understand what position they're in, what sort of anxieties they have, whether they are following the rules, such as they are, staying at home, keeping out of the way of other people. And I think you have to understand that you've got probably almost certainly got to plan for them. They are going to settle into a routine that's not the ideal routine. It's not the one they're used to. They're used to going out. They're used to being able to socialize with their friends, going out to lunch, going out to this and that. That's all going to change. So try to explore with them some of the things that they can do and are able to do, which are going to make up for that. They recognize just as much as the rest of us do that life has changed enormously. So how can you help them communicate with their grandchildren, with their children, and their friends? How can you get together, have virtual parties, virtual socials, virtual lunches, and so on? What are the ways of being able to do that? So those are some of the things I think that they can do to be more than anything else, probably, to lift their lives up a little towards where they used to be. Be aware that they are determined, almost certainly, to keep control of their lives. They want to be the decision makers, and most parents are pretty stubborn when being told by their children what to do. So one has to be aware of that and to make certain that you're able to talk to them, able to find out exactly what sort of ideas they have about the changes that are happening, and make it a conversation, make it a discussion, not just you telling them basically what they should be doing. They know what they should be doing, but they need to make those decisions themselves usually. And that's quite a step to make it, but it's a step one has to make with all elderly people, particularly as you get into the 80s and so on. But you have to be very careful to allow them to make the decisions for themselves. That's what they've been doing for the past 80 years, and they want to go on doing it. So that is first and foremost, I think that's probably the most important thing that you can do for them. I think the second thing would be to start compiling a list of information about them. You know, how many people actually know who their parents' doctors are, what insurance company they're on, and the telephone numbers associated with that. And how do you go, we put actually on our website a checklist for people, which may be helpful to go through to ask some questions like that and to get that sort of information. You don't have to do it all at once, but it would be useful, I think, to have that sort of information kept about your elderly relatives. You're going to have to face sometimes some very uncomfortable questions with them too. What happens if the worst happens? What are their desires? What are their wishes about that? Do they have some form of living will, of what used to be called the sort of directives as far as what happens to them if they should go into hospital and so on. So those sort of things, I think, sum it up pretty well.
Yeah, I think that's great advice. And again, if there are elderly people, even your neighbors that you know of, reach out to them, you know, text. I've seen some of those good news stories of people standing outside, you know, the windows of their neighbors, just a sign saying hi to them because, you know, they maybe don't have their cell phone or they can't call them or whatever it is. But just reaching out to your neighbors right now, and especially your elderly neighbors and family members.
Making contact with them, talking with them, talking.
Right. I mean, we really all could use some of that right now for sure, just to help with all of us that are maybe stuck in our houses as we physically distance. I'm just looking at the Facebook feed. Someone did just say they were denied Medicaid and they are 62 years old. Again, Robert he's with Well Advised, which is Medicare advice. But I did want to say that Connect for Health Colorado, the health insurance marketplace for our state, they've opened a special enrollment period through Friday. You can apply for benefits. So go to connectforhealthco.com and you can apply for insurance benefits during this special enrollment period. So hopefully that kind of helps you out, Deborah, since you said that you have been denied Medicaid. Maybe there's some other resource there for you. But Michelle, I wanted to ask you for a moment. Dr. Morris talked about, you know, reaching out to the elderly, really just checking in on them. I think we all, you know, need a little bit of that right now, as I mentioned. And I wanted to ask you about some of the mental health resources that the state has as well. We talked about mental health all last week on some of our Facebook Lives, so you can check those out on our Facebook page. But Michelle, just let us know what resources people have through the state right now that they can reach out to.
Thank you for that question. This is a really hard time for people that have existing mental health conditions or substance abuse conditions. And so we really want to make sure that they know that all services remain open. People across the state are here to serve them. For some of us that don't normally have those issues, you know, pandemic can cause you to feel more stress. And so I really encourage people to reach out to the state crisis hotline, which is 1-844-493-8255. And that's around the state, and they can connect you with people that just can talk with you, or if there's an urgent situation, they can connect you with practitioners in your community that can help you. So I really want to encourage people to reach out and ask for help if they at all feel they need it.
And we have a couple resources on 9healthfair.org as well. You can take a free mental health screening for anxiety, depression. It's all anonymous, but you get connected to some free virtual help. You can talk to someone if needed. So that is another resource as well. And I'll post the crisis hotline in the comments so we have that. I want to go back to
can I just add something? Okay, may I just add something, which is if you have a parent suffering from Alzheimer's, dementia of some form or other, this is a particularly difficult time for them. And the Alzheimer's organization does have some very good advice on its website to help you not solve that sort of problem, but actually cope with it. And that's worth mentioning.
Yeah, great. Thank you for adding that. Brooke, I want to go back to you, and Erin, back to you as well. Again, I'm kind of going to rehash for people too what we've been talking about, just because people, you know, come in, come out. We're talking with everyone until 5 today. So this is our 9Health virtual town hall. If you have any questions for any of these people about volunteering or receiving help, please ask those. You can also ask general COVID-19 coronavirus questions and we will get those answered. But Brooke, talk about how you're with Vitalant, talk about how blood donation is working. And I think the question that keeps coming up is, one, are you testing blood of people for coronavirus? How does that work? And should people feel safe going to donate blood, going to a center?
Yes, so we do not test for coronavirus when you come in and donate blood. So if you're trying to come to a donation center or drive to get tested for coronavirus, please don't do so because there is not one at our centers. So in terms of our blood being tested, we always test our blood for numerous things every single time someone comes in to donate to make sure that blood is safe for those patients that receive it. But yes, we do not have a coronavirus test to kind of tell these people coming in to donate if they have coronavirus or not. So please don't come in just to get tested for coronavirus. We really need you to volunteer and give the blood that these patients need to survive. So yeah, I hope that answers that question a little bit.
I would just add one thing to that, which is that, when we donate blood, we don't test for flu. And this is a respiratory virus just like that. And so people may be wondering why we're not testing for coronavirus, but it's because even though there may be viral particles in the blood, they don't necessarily confer infection, as best as we can tell from the scientific literature. There have been no documented cases of infection through blood transfusions. But again, we're learning about this virus. So, every day is a little bit of a learning process. But as far as we know, it's not infectious if you have coronavirus or if you receive the blood of somebody who has coronavirus.
Yeah, thank you for adding that, Dr. Coley. And I even had a family member ask when I was saying that we were doing this today, well, could they just test the blood, and if coronavirus is found, can we use their platelets or do something? Like, is there, I don't know what's being talked about really out there, but Dr. Coley, maybe you can talk about that, like using the blood of someone that's had coronavirus. So I mean, Vitalant's not testing for coronavirus, so it's kind of a moot point, but I was just curious about that.
Yeah, I think that it sounds like you may be thinking about two different issues here. So one is blood donation and whether you can give blood safely if you are not symptomatic, but maybe an asymptomatic carrier of coronavirus. That's what we answered as the yes. We don't think even if you have coronavirus in your blood that it's going to infect somebody else. They do check your temperature and they do ask you about symptoms and all that kind of stuff. So we're probably not going to miss the people that have symptoms, but it's really those asymptomatic people. The second question is the blood of people who've had coronavirus and recovered. And this is actually a treatment under investigation right now that has showed a lot of promise in early clinical trials. And it's called convalescent sera, where you take the antibodies from somebody that has recovered from the coronavirus and inject them into somebody else who's either fighting the illness or you're trying to prevent infection in a person who's been exposed. Now, in terms of platelets versus red blood cells, it's kind of a moot point because the blood is made up of many different components: platelets, red blood cells, coagulation factors, lots of different things that are isolated at a blood bank. But if you have coronavirus in your blood, it's going to affect all of those components of the blood. It's not like it'll only affect the blood cells and not the platelets. So hopefully I answered your question.
Yeah, my question was all over the place, but thank you for clearing that up. I just keep hearing different things about blood, and I didn't know if we would get any of those today, and just wanted to kind of put that out there as well. Erin, I wanted to ask you, just go over again how people can get food assistance right now. Someone did ask about being homeless, what we're doing for the homeless, but just talk about what if someone does need food assistance through Food Bank of the Rockies, how that works right now.
Yeah, so Food Bank of the Rockies website, which is foodbankrockies.org, is a good resource for either getting help for food, volunteering, and we have health criteria on our website with what that health status criteria are, or making a financial gift. And Food Bank of the Rockies has drive-through mobile pantries, so we are increasing safety and social distancing throughout the area of Colorado that we serve, which is about half of Colorado and all of Wyoming, and many of our partner organizations. So we have about 100 emergency support team pantries that we're working with, distributing food in every single county. And if someone is outside of Food Bank of the Rockies area, the entire state of Colorado is served by other food banks, which they can find at feedingcolorado.org.
I'm going back to the gallery. That's helpful. So feedingcolorado.org is a good resource. And Michelle Barnes, maybe you can talk about what's being done as well to help the homeless population right now, food, shelter, housing, how they're handling things with the coronavirus.
Yeah, I think a lot of us are concerned about our homeless neighbors and what's happening to them. Different localities are dealing with it in different ways, but across the state, we're all coordinated and sharing resources and best practices. For the most part, most counties are trying to find hotel beds or college dorm rooms where the homeless population that has symptoms of COVID or been tested positive for COVID can actually go stay and isolate themselves. If you live on the street, it's really hard to self-quarantine. So we're working community by community to find safe places for people to isolate themselves. As part of that, we're getting them food assistance and whatever healthcare necessities they need in order to survive COVID and move on.
And we brought this up earlier when you're talking about the new child care funding, I guess the tuition that essential workers can receive to get child care for their child for the next 6 weeks. And people keep asking who's an essential worker. Again, you can go to covidchildcarecolorado.com, but essential workers are, those in healthcare, obviously, first responders, those in the media, people that are having to work right now to support the coronavirus and coronavirus response. Food, there's grocery store workers, correct? That would be essential workers. And okay, so COVID Child Care Colorado, you can see if you qualify. So go to that website. Someone on that note, someone said, why is CDHS advising child care providers take all children, not just essential care? Maybe you can talk about the protocol right now for daycare. Is it limited to only essential workers right now? Is it for anyone still?
Right. There's a lot of people who have a need for childcare that aren't traditionally considered essential workers. It could be someone who's caretaking their elderly parents across town, and they still have a need for childcare. So childcare centers are independent businesses, and they're absolutely open for business and are dependent on consistency in terms of families supporting them and bringing their children now during the time of COVID and long after this is a memory. So we're trying to supplement those childcare providers and stand up new ones to provide licensed childcare for essential workers, many of whom didn't use childcare prior, but they're needing it now because they're working extra shifts. They're maybe their elementary school kids are at home and they need a safe place for the kids to go during the day. So I will say this emergency childcare collaborative that we're standing up is there to support kids up to age 14. So not just the traditional pre-kindergarten children, but we're trying to help any children that need a safe place to be during the day.
And
Okay,
Michelle, I did have a question for you as well. As you know, the governor and the mayor have shut down a lot of schools and such to aid with social distancing. So what measures are being taken to kind of maintain those types of precautions in these child care centers that are operational at this time?
That's a great question. Child care centers operate in a pretty rigorous health and safety environment all the time because there's little children there who don't understand that they need to wash their hands every so often. So there's a lot of health and safety requirements around child care centers. At this point, we're providing extra guidance to them. Things such as keeping physical distancing as much as they can, limiting classrooms to 10 people, spending more time outside, more rigorous use of hand washing, more cleaning of the surfaces than would normally happen. So through our local public health authorities, we're able to provide a lot of guidance for childcare providers who are choosing to stay open. And I will say more than half of childcare providers in Colorado have shut down due to COVID-19. So we're really trying to give as many resources and as much support as we can to those centers who are willing to stay open and take care of our essential workers.
Yeah, and Dr. Coley, I wanted to ask you kind of related to that. The governor announced, keeping schools closed through April 30th today. Someone asked, do you think it'll be safe at the end of April for our kids to return to school realistically? Is that even a realistic thing to say? Let's keep them closed through the end of April. And I think even some schools are saying, we're closed through the end of the school year. But what are your thoughts on the safety of that?
I think we'll really be able to return safely once we've kind of gone over the peak and come all the way back down. And so the likelihood of doing that by April 30th is probably on the low side, because most of the country is expecting its peak in about 2 weeks or so, and it'll probably take at least 2 to 4 weeks after that probably to come back down. When we do relax the social distancing and open up the schools, we're going to expect a second wave of cases. And that's why it's critically important that we're really ready for that second wave before we relax these guidelines. And so April 30th is an optimistic target, in my opinion. If we can do it by that time, that would be great. But I think likely it may be after that.
Okay, and Michelle, I've gotten a couple more questions that I think you can answer. Popular one right now. Someone asked, they're 61, not computer savvy. They applied for unemployment for the first time. I don't know if you can answer an unemployment question right now, but what is a resource to help them follow up to ensure that they get their benefits? Can you offer any insight to that?
Yeah, unfortunately, our unemployment systems have been bombarded with a lot of requests over the last week. And so I just encourage you to keep trying. We're adding capacity there, not just in terms of bandwidth, but also reps being able to take your calls. So please just keep trying. You're doing the right thing. There are people there to help you. And we're doing the best we can given the unprecedented demand for unemployment benefits.
And I know my husband's temporarily out of his job. He works at the airport, so he's able to apply for unemployment, and it took several days to get in. And thankfully, the state started, making it certain people can apply on certain days with a certain last name, letter of their last name. So that helped, and that's when he got in. And I forget who asked the question now about unemployment, but my husband then received follow-up communication with a PIN, and I know that can take a few days as well. So maybe just being patient, waiting for that, those emails and communications to come through. I'm just trying to scroll through everything that we've got in here. Steve did ask, Michelle, this is another one that you could answer. They said specifically, who do the homeless contact for help?
Go
ahead.
That's a great question. In every community, there's different groups that are supporting this. In the Denver metro area, there's Colorado Coalition for the Homeless. There's a myriad of nonprofits serving the homeless. So I'd encourage them to call the local homeless philanthropic community and ask for help. If that is not an option for them and they don't know who to call, they can always call 211 and we'll connect them to homeless resources within their own community.
Thank you, that's perfect. And I'm posting these resources in the comments kind of as we go, but I can post some of them later. Again, we have about 15 minutes left. This is a 9Health virtual town hall hosted with 9 News. You can ask your questions about the coronavirus, ask your questions to any of these people that have joined me today: Food Bank of the Rockies, Vitalant, Colorado Department of Human Services. Dr. Robert Morris is with Well Advised and has advice for some of our elderly community members, and then Dr. Coley, our 9Health expert, can answer medical questions as well. I'm trying to just see if I have anything else that I can pass along to you guys in the comments right now. Again, 9Health Neighbors is another program that we have started. You can call that line 303-698-4455 extension 2005. That's in the comments. If you have a health question that you want to ask, or you know someone that isn't computer savvy, isn't on these Facebook Lives, isn't able to watch these and ask questions, give them that number. They can call, and within 24 hours, a medical professional will give them a call back. Another thing that, and I asked this yesterday, and I didn't on our Facebook Live, and I haven't prepped any of you for this, but another thing we're doing with our 9Health Neighbors is we're really looking for those good news stories. Do any of you have any good news stories that you've heard? Erin, maybe I'll start with you. I mean, you're around a lot of people at the Food Bank of the Rockies. You guys are helping a lot of people right now. I think you said double what you normally help and see. Talk about maybe if there's a good news story that you can share.
Oh my gosh, we have good news stories every single day, and it's what is getting us through. We had this whole family in volunteering the other day. One of the parents is a teacher, the other parent is unemployed, and they're here giving back and just walking through it. It's empty right now behind me, but that's because all the volunteers that were here and socially distanced earlier today, that those shifts are all finished. But it is a crew of smiling faces that are here to give back. We had a donor who contacted us to say, I just received a 50% job cut today. So 50% pay cut, and I've emptied my PayPal account and I'm donating that to Food Bank of the Rockies. And then our food distribution, when we go to our drive-through distribution so we can maintain that social distancing, people are incredibly grateful. Like, I don't I would have done if I weren't able to receive food right now. And here we are, April 1st. We have a lot of tough choices this week: pay rent or buy groceries. And so we're committed to being here for our community, thanks to the generosity of our donors and our volunteers.
Yeah, those are great stories. And Brooke, with Vitalant, you probably have some similar experience with people reaching out to donate blood right now. I think a lot of us are looking for ways to help. Are there any good news stories that you can share?
Oh, so many people have been stepping up and coming in to donate blood. I've seen so many messages on our Facebook page just saying, I was so cooped up in my house and I didn't know how I could give back. And this is something truly selfless that you can do, and it's free. So yeah, we've seen so many different things. And of course, those stories where people are donating in honor of someone, or someone may have been fighting cancer, so they're donating platelets. We see that on a daily basis, but right now we've seen a lot of first-time donors coming in. Their first time ever, they thought they'd give it a try to help back right now, and that's been truly amazing to see.
And again, we've been talking with Brooke. It is safe during our stay-at-home order even to go donate blood. They're taking measures to make sure that it is safe. Same with Food Bank of the Rockies. If you're looking to volunteer, they have measures in place where you don't have to be there to volunteer, or even the drive-up pantries. For getting food, they're taking measures as well during the social distancing, kind of changing the ways they have to distribute, and even the way they handle volunteers. Anyone else want to share a good news story that they know about? Dr. Morris, maybe you have a good news story that you can share. I know we've been talking with you about tips for the elderly and making sure we check in with our elderly neighbors, family, friends. Anything you'd like to share?
Well, I think the one thing is how do you get a haircut when you're old? And you have to stay at home. How do you, particularly if you go out normally and get your hair rinsed and made purple, whatever color you want, how do you do that now? That's going to be a problem for a lot of elderly people, I think. And I'm sure, like everybody else, I've seen pictures on the web of mostly young people having their hair shaved by their mother or their father or their son even, and it all going completely wrong. So there are a lot of stories like that, but there's an awful truth behind them, which is there are some everyday things that particularly elderly people are going to be having to rethink about, and I think their children can help them do that. Another one is makeup. We're encouraging people on our website to look good. Even if you're not going to be seen by anybody, it helps you inside to make yourself look good and get dressed and put your makeup on and so on. So is there a danger about putting makeup on? We give some advice on that. I find those sort of images very encouraging, because I think there are things that we can do to help people in their ordinary, simple tasks that are now much more complex.
Yeah, and they're really complex. Yeah, go ahead.
I can add some unexpected just sparks of joy that we've seen. Is I think everyone in the community knows right now that food is such an essential service. And right now, some of our nonprofit colleagues and other nonprofits in the community aren't able to be in operation. So we're receiving a lot of phone calls, and how can we help? So Habitat for Humanity sent their warehouse staff here the other day to volunteer. Boys and Girls Clubs of Metro Denver is sending their staff to volunteer. We're also forging new partnerships or expanded partnerships, like with Children's Hospital, which is distributing a lot of food, Rose Medical Center, Dispatch Health. And I feel like it's this time where unlikely partnerships are coming together because we're in this together, even partners that wouldn't have been as logical before. And there is just what can I do? I'm here to help. We're talking to corporations about lending us trucks and drivers and other partners. And it is we are all in this together mentality right now.
Yeah, I think that is a good side effect to really all that is going on. Obviously, what's going on right now is not the greatest situation, but there is some, like you said, sparks of joy that we are kind of seeing within our communities that are really helpful for all of us too, that just need that little, glimmer of hope and ways that we can help. And that's why we did this town hall today, to give you some ideas on ways that you can help if you are looking for a way to help. Or again, if you do need help, these are some resources that you can reach out to. Dr. Coley, you're in the newsroom. or not in the newsroom, I guess, that much anymore, but connected to 9 News a lot. Any good news stories that you've heard or that you want to share that you've seen in the last day or so?
My good news story comes from a high school friend of mine. Not only is she making masks, she actually also acknowledged that a lot of what we call essential workers are those people that fall between the cracks. So postal workers, the people that, you know, do housekeeping and cleaning, a lot of the people that are still coming to work, still exposing themselves, but we don't traditionally think of them as the essential workers like we do the healthcare professionals and the firefighters. So she actually had food sent to her local post office as a way to thank them for working as hard as they are.
Yeah, that's a great story. Brooke has her dog that's joined us. My toddler is now in the room. This is real life now. And even like Dr. Morris was saying that, you know, elderly, there's some resources for doing your hair, doing your makeup, you know, getting things done still while you're at home. We still kind of all need that because now we're in this virtual world where we're on camera all day with all of our, you know, we're used to in-person meetings, but it's a little different even just being on camera. In these Zoom meetings. Michelle, someone did comment about unemployment and difficulty about getting through. Again, like she said, just keep trying. They're really trying right now. It is difficult, like a difficult time with a bunch of people needing benefits right now. But Michelle, maybe you have a good news story that you can share.
I will. One of the biggest challenges we're having as a state is to get enough masks and PPE and other safety materials to keep our healthcare workers safe and able to continue to go into work every day. And we have found many people who, oh, there's your son, I love it. We found many people who are finding supplies that they're donating to the state or giving to them. Today we had a small business who had found 850 hazmat suits and sets of PPE in their warehouse and donated to the state to help our frontline workers. We also have people all over the state making face masks that they're sending into hospitals and other health facilities. And it's amazing how much it means to a healthcare worker to get a face mask that somebody handmade and was thinking about them and sent on. So lots of good news every day, and we appreciate everything everyone's doing to help our healthcare workers.
Yeah, definitely. I have some friends that are making those masks as well.
Thank you.
And I think it is, Dr. Coley can talk about this a little bit. I think it is hit or miss whether a hospital can take them or not. But I even have my sister-in-law does physical therapy, occupational therapy for people, and they're able to use those kind of masks in their setting at kind of a private healthcare center. They're still essential. They're still working. But it's, you know, just depends on where you can donate that kind of stuff. And Michelle, I did want to ask if I know on the website, helpcoloradonow.org, which I think reroutes to covrn.com. That's the new state health website or state website that has different resources and ways for people to help and get resources. If someone does have stuff they want to donate, is that just where they need to go? Just go to that website and there's an application, or how does that work?
They can absolutely start there and put in what they have, and we'll connect you to the right location. There's a lot of people throughout the state who are collecting donations. And on the face masks, if you do make face masks and your local hospital is not able to take them, contact nursing homes and residential care facilities and other people that directly work with vulnerable people, and I know they'd be happy to take them. So, but always helpcoloradonow.org is a great place to start.
All right, everyone gave me a good news story or some good news. I think that's a good note to end on. We have about 5 more minutes here if anyone wants to add anything. Again, my toddler's woken up from his nap. This is Macklin. He's 4. His daycare is still open and he's not going, but they are open to essential workers and even others. I talked to them last week. So there are places for you to still take your children if you need to. And we talked about schools being closed through April 30th and whether or not that'll be safe for kids to return. Dr. Coley addressed that a little bit. But if anyone wants to add anything else, I'll kind of just open it up to you guys. We have about 5 more minutes here. I'm just scrolling comments to see if there's anything else that I can pass along to you. Yeah, if anyone else wants to chime in and say anything, go for it.
If I could jump in, this is Michelle, from Department of Human Services. One of the consequences of kids not being in school is that the number of calls to the state child abuse and neglect hotline has diminished by over half. Normally it's a teacher or a librarian or someone at the school that notices something is amiss with a child or with a family, and they notify us so we can get services to that family. With school closed, I'd like to say the amount of child abuse and neglect in our state has gone down, but it's just that the reporting has gone down. So I'd like to encourage anybody out there that has any concerns about neighbors or family or friends to call the state hotline at 1-844-CO-4-KIDS. It's really important that we have lots of adults having eyes on our vulnerable children. So thank you for that.
And Michelle, on that number, it's the number 4, correct? CO number 4?
Yeah, 844-CO-4-KIDS.
Yeah, I think that's an interesting point to be made. That, yeah, Macklin thinks so as well.
Stephanie, I can add on to something about kids if you like. You know, one of the most frequent questions we've been asked is like Michelle was saying, people are really concerned about kids right now, and also concerned about how are kids going to have enough to eat when they previously relied on meals at school and their backpack of food to take home over the weekend. So we've started partnering with Denver Public Schools and Food for Thought for grocery bags for kids to take home and their families at Denver Public Schools meal sites, which they can take home on Fridays, the bag of canned goods and other perishable food. And we also have some other partnerships. We're distributing food at some Boys and Girls Clubs locations, some YMCA locations. And then of course, serving the whole family through our mobile pantry, our drive-through distribution. So we're definitely keeping kids front of mind right now because food security is a very real challenge for so many families who are all of a sudden going without a paycheck.
And Michelle, and he's just going to take over. He's going to host now for me. I don't even have to do this anymore. Aaron, I did want you to ask, though, you cut out a little bit when talking about how people get that resource for feeding their children right now through is it through DPS?
Yeah, at all public schools meal locations, we have grocery bags that are put together by Food for Thought and Food Bank of the Rockies that they take home on Fridays. And then the meals are provided during the week by Denver Public Schools.
If someone is in need of that right now, sorry, I think I keep missing it because he's talking in my ear. If someone is in need of that right now, can they go to Food Bank of the Rockies website to get information on that?
So Food Bank of the Rockies, foodbankrockies.org, we have all of our food distribution sites, specifically if they're looking for a Denver Public Schools meal site, that is on Denver Public Schools Foundation or Denver Public Schools website.
Okay, thank you for clarifying, just because, yeah, things are just happening. We have about 1 minute left in this town hall. I want to thank you all for joining us. This was a 9Health virtual town hall. We are continuing to go live on Facebook. We're going to go live again next week a couple of times. We'll post that schedule on 9healthfair.org and connect you to the experts, really that you can, and the source resources that you can ask your questions.
Yeah,
and get your help.
You like to everything.
Okay. This is my son Macklin. Again, he's 4. He's a lot of help. And this is our working from home reality right now, and that's how things are going. But anyway, I also wanted to mention tomorrow I will talk to Dr. Robert Morris again with Well Advised. He's going to give us, again, some more advice for our elderly family members, friends, for those that are over 65. He'll have some great advice for you tomorrow, so I'll be chatting with him on Facebook Live tomorrow at 3 p.m. on the 9 News and 9Health Fair Facebook pages. And on Friday, we're going to talk to Dr. Jennifer Bolton. She is a licensed dietitian. She's a dietitian, and she's going to give us a recipe for using some of the staples in our pantry. And we'll also be talking about, food donations, how that's working right now. But Aaron, maybe you want to address again how food donations are working right now. You can't just go to Food Bank of the Rockies and drop off some food. We want to reiterate that point.
Yeah, we actually can take food donations, but it's actually complicated for us right now. So we're encouraging financial gifts rather than gifts of food. Any gifts of food have to be cleaned, sorted, and redistributed to our food pantry partners. Whereas financial gifts, we can actually distribute 4 meals worth of food for every dollar donated, just because our efficiencies and our procurement and our donation and purchasing and distribution practices. So financial gifts go a lot further than donations of food.
Perfect. So I'll be sure to mention that again on Friday when we are taught. We're going to make a recipe with some of pantry staples, because by Friday, I'm out of dinner ideas for the week. It's a lot of dinners and meals to make while we're at home. And you can order takeout. We've talked to Dr. Coley about that before. Takeout is safe to order from your local restaurants and things to support your local businesses as well. But it's 5:01. I'm going to let you all go. Thank you everyone for joining us. And I said at the beginning, but a reminder, today is the Census Day. Go to 2020census.gov. take the census. It's important because it determines funding for all of these health-related resources in our communities, healthcare centers, Medicaid, Medicare, children health insurance programs. Many of those receive federal funding, and the census is what determines that. So fill out your census, 2020census.gov, and go to 9healthfair.org and click on our 9Health Neighbors program. The number's on there. It's 303-698-4455, extension 2005. Call that line, and within 24 hours, someone will call you back, answer your health-related questions. And we mentioned, some good news stories. We're also looking for those good news stories. So call that line and just tell us some good news that you have to share, because we would love to hear that as well and follow up on some of those stories. So thank you all for joining us. I'm going to sign us off for now. And yeah, that's it. Thank you.